How do you think we'd be able to end up implementing the route map for the NHS?
Well, of course, it's not our job to implement the route map for the NHS. It's our job to offer the route map as a common framework for action across the NHS in England, but also for partners, for other health systems around the world, and to really make sense of a lot of activity that's going on, but maybe activity that's possibly uncoordinated and unsystematic. So the real point of the route map is to bring order to a mass of commitment and enthusiasm.
Do you think the NHS could ever be truly sustainable? I mean, it's so massive. Do you think we could ever coordinate, or so many people could ever coordinate to actually do something that positive?
Well, it depends what we mean by truly sustainable. Don't forget, if you just talk about the carbon element of sustainability, we all have a carbon allowance. I mean, we may be using 3 times our carbon allowance, but in terms of making it sustainable, if the question is, can we provide high quality healthcare in perpetuity within the resources we've got? Yes, we can. There's no doubt we can. We're not doing it at the moment. We can do it. There are some things we don't know how to do, but it's not beyond our wit to find out what the ways there are of doing it. So yes, we can provide healthcare sustainably.
What do you think is going to make the biggest sort of seismic shift in actually getting the NHS to reduce its carbon footprint?
I think there are 2 possible seismic shifts. I mean, the future may prove me wrong, but the 2 seismic shifts I think are not only important but necessary. One is a public willingness to see this happen. Without the public, we can do nothing. With them, we can do almost everything. But the other is a true economic costing of the resources we use and the carbon we generate. If they were properly costed and properly valued, we'd move towards that sustainable health service even more quickly.